The great majority of people that we see are coming in once they've tried other things, the typical headache, migraine, back pain, neck pain. They've done a lot of the medical routes and have not gotten the response that they wanted. So typically there are people that are looking for something a little bit different. Obviously, in my opinion, this is a little bit more holistic. We're trying to address the cause of their pain, which many times is a problem with their spine. And if that's the case, we can address that issue and help them out. It's funny. We get the question. I hear it often. I heard once you see a chiropractor, you have to go the rest of your life. And I have to laugh at that because from my perspective, well, yeah, why would you not want to? So the answer to that is if you are actually functioning at a higher level and you feel better as a result of having less irritation on your nervous system, a lot of people do choose to go for the rest of their life, but more from a preventative and wellness perspective. The reality is a lot of people feel such improvement with what we do that they choose to come on an ongoing basis. If you show up on any given day here on a busy day, I would say 60 to 80% of the people are here not because they're in pain anymore, but because they're actually wanting to just stay healthy or they feel better being under care. We've been doing this for 26 years, and through the years we've had a fair amount of what we would call a pediatric practice, kids that are coming in and getting adjusted. And typically it's not a child doesn't tell you they have low back pain. I would like to think they don't, or that they have headaches. The pediatric stuff we've seen traditional are infants that have chronic ear infections that the antibiotic use has not helped them, or we've seen a lot of ADHD kids, or occasionally an asthmatic child. And the distinction there is not that we're experts in asthma, it's that if that child has abnormal nerve irritation, it's keeping that body from functioning the way that it was designed to function. And if you can release that irritation, then the child's body does what it's meant to do, which is to breathe normally, or to not be hyperactive, or to not have chronic ear infections. We get that question a lot too, and people hear a lot in the media about sometimes how unsafe it actually is. You're talking to somebody that was raised by a chiropractor, and quite honestly, after practicing for 26 years and watching a father practice his whole career, I've never really known any significant adverse effects to chiropractic. People hear about strokes, and really that's the main thing, and I've never seen it happen. Now, could it? I guess it's possible. I'm sure some people are a little bit susceptible to that happening, but if you look statistically, the chiropractic adjustment is one of the safest medical procedures there are out there. They've done studies that you actually have more chance of being struck by lightning in El Paso, Texas than you would being hurt by a chiropractor.
Find out how Georges Chiropractic and Wellness Center can help you and your family. Call us today, 915-592-3333 for your next appointment. Find us on Facebook and subscribe to our YouTube channel for more educational videos and tips. Thank you.